Um, Tied to the myth of Medicaid for going to individuals who are not working or who are undeserving, rural Americans in particular say that hard work and self reliance is an important value to rural culture and to rural people. But about a quarter of rural Americans themselves are enrolled in Medicaid, and about half of rural births in the US are provided for by Medicaid. Medicaid is therefore critical for the health and economic survival of people who value hard work, perhaps more than other groups in American society, although I imagine that's pretty debatable from an empirical standpoint. Over 20% of the typical rural hospital budget is financed by Medicaid. And even prior to these cuts, rural hospitals all across the country have been operating on razor thin margins, many of which are operating in the red. If we look across the country, we can see in states like Georgia, nearly 2 dozen, or about a third of remaining open rural hospitals are operating with negative operating margins. In Texas, it's nearly 70. In Kentucky, it's over a dozen. No matter what kind of state we look at in terms of expansion status or not, Republican versus Democratic controlled, what we observe are the large percentages of rural hospitals are facing financial ruin even prior to these cuts. And when you're operating on a negative margin and suddenly 20% of your budget is drastically shrunk, that is going to be pretty devastating for the continued survival of rural hospitals all across the country. The KFF estimates that about $120 million in healthcare spending will be lost for rural communities as a result of this bill over the next 10 years. That's about 15 to 20% of total healthcare spending in rural communities as is. So we're talking about massive financial effects on already struggling rural hospitals. That doesn't factor in what we would also observe in terms of the increase in uncompensated care loads for rural hospitals lost as a result of folks losing their Medicaid coverage. Rural hospitals struggle primarily due to their high uncompensated care loads. That is, lower income and uninsured folks coming to hospitals, receiving medical care that they cannot pay for or for which they're not insured for. The Medicaid expansion under the Affordable Care Act drastically improved rural hospital finances in the states that expanded Medicaid. As a result, since 2013, about 80% of hospitals that have closed in rural communities have been in states that did not expand Medicaid under the Affordable Care Act. The provisions of the Senate bill will roll back many of those financial gains that we've observed in rural hospitals in expansion states and be particularly hard for rural communities across the country to stomach. Estimates suggest that Kentucky, Ohio, and North Carolina are the three states that will face the largest cuts to rural health care. These are all states that expanded Medicaid under the Affordable Care Act and have drastically improved rural hospital financing as a result. One estimate shows that over 125,000 Kentuckians, for example, will lose their health insurance as a result of this bill. So we're talking about communities that are and people who are already struggling, losing their access to health insurance and likely losing access to their hospitals. If we look across the country, the overwhelming majority of communities that are likely to lose their hospitals are in counties that voted for Trump on a large basis or in congressional districts that are represented by Republicans. In fact, the states that stand to lose the most from these Medicaid cuts are states that have two Republican senators. And if we dive a little bit below that, we're talking about overwhelmingly Republican rural areas. This is very much an attack on Trump's base electorally, but also an attack on some of the folks who have the least amount of reserves to survive these major cuts across the country. The effects of the bill are, and the Medicaid cuts in particular, are harmful for Americans' health, but also economics. In terms of health, when a rural hospital closes, there are demonstrably worse health outcomes as a result. regardless of whether or not you have a stroke or a heart attack or you're bitten by a snake. It doesn't matter whether or not you have private insurance, employer sponsored insurance, or Medicaid. If your hospital is gone, you face increased mortality risk as a result of virtually any health condition by having that hospital be further away. In some cases, what we're talking about is an additional 20 to 40-minute drive. For many conditions, that can be the difference between life and death. And most health professionals quip things like time is tissue. And what they mean by that is the longer it takes you to get appropriate medical care, the more likely you are to suffer fatal consequences. Hospital closures complicate distance to care for all people, regardless of whether or not they're directly enrolled in Medicaid. So, for rural communities where the population is aging at quicker rates, for rural communities where individuals tend to have worse health outcomes on average, what this means is compounding all of those issues to add further distance to care. It also, these cuts will have tremendous economic consequences for rural communities across the US. In many rural areas, hospitals are the largest employer. In some rural communities, 15% of the population works in the hospital. So when a hospital closes, not only does the entire community suffer in terms of its health, but unemployment rates spike, incomes decrease, and the community overall experiences significant decline. It's also less likely that the community will be selected for new economic investment. If you're looking to open up a new factory, you're looking to bring manufacturing jobs to a community, the lack of a hospital is a real negative for recruiting future employers. So much of what will occur as a result of these cuts are that communities that have already been in pretty significant decline over the last 20 years will be kicked further down, and people who have already fallen behind will struggle to ever catch up as a result. A sociologist at the University of Michigan, Robert Manduca, I think provided some of the most useful analysis for conceptualizing the economic effects of Medicaid cuts. So, in Kentucky's 5th congressional district, of which the majority of residents are enrolled in Medicaid, Medicaid encompasses a quarter of the entire economy of that congressional district. So, what we're talking about is a massive economic hit to what is providing 25% of the economic stability of the community. Manduka also showed that this will be the economic equivalent of Maine losing its entire forestry and paper manufacturing industry, that these cuts would be similar or on the order of Alaska losing 60% of its oil and gas industry, and that Medicaid is more critical for the economics of Houston than the entire chemical industry, of for Los Angeles, the entire film industry, and for Detroit, the automotive industry. Medicaid is critical for the economic growth of communities all across the country, and these cuts will not only affect the livelihoods of folks who are enrolled directly in Medicaid, but will devastate economies across the country, perhaps especially and most quickly in rural communities and lower income communities all across the US. These closures will oftentimes lead to the hollowing out of other medical providers in these communities. It's very common that when a hospital is facing closure, OB coverage or labor and delivery services are eradicated to save money, surgical options decrease, emergency departments close, and eventually hospitals close shop altogether. These will have devastating effects on the many rural communities that are already only surviving on the knife's edge, most of which are communities that voted for Trump in part in hopes for a better future and are now facing, in many cases, economic ruin as a result of this bill.